All right.
Don't I have to be your
This
kid?
just goes to show that there are at least 5 people present.
I'm so excited.
I know, they are excited. 5 slightly interested people. All
I
right.
think that's actually one.
That, well, there's at least 5.
Yeah. There's
Proves
6.
that I can at least count as well.
0. I'm mildly conscious.
Mildly conscious. All right.
You're not going to show the audio on this, are you?
Maybe. We're going to do I/O training. All we're going to do is go over the protocol and the landmarks. That's all we're going to do. And then evaluations afterwards.
Here you are.
Thanks, friends.
You have to introduce yourself and tell where the restrooms are and the emergency exits.
Yeah, exactly. Restrooms,
Objectives.
emergency exits. Okay, so real quick, let's just go over the I/O protocol for the moms. It says adults over 40 kilos of weight. That doesn't necessarily apply to us because we have 3 sizes of needles, and the pediatric needle goes down to 3 kilograms. It's a pretty small needle, so we do have 3 different needles. 15, a 25, and a 45 millimeter needle. Our indications are for alternative to a peripheral IV. We use that sometimes first line access. If we know we can't get an IV immediately, we'll go right to the IO. And then cardiac arrest. Contraindications is patients under 40 kilos. Again, that doesn't apply anymore because we do have multiple needles for this thing. Fractures in the tibia or femur, or frankly any of the bones that we're going to put this in. This is a little bit of outdated part of the mom's manual. Previous orthopedic procedure, knee replacement. Obviously, if they don't have a bone there, we can't use it. Infection at the insertion site, inability to locate the landmarks where you want to put them, excessive tissue of the insertion site. If we can't get the needle in to hit the bone, it's not going to go in, and the tissue is going to push it out. And then previous attempts, if we're putting more than one hole in that bone, the fluid's not going to flow into the intraosseous space. We can give any medication into that IO that you can put through an IAV, and depending on where you put it, the flow rates are just as fast as an IV needle. There's a fluoroscope video that I'll show in a later training that shows how fast this enters the body. It's quick. So we have our primary site is the tibial tuberosity. It's the proximal. That's our first site, and you'll find the tibial tuberosity, and you're going to go just medial of that. There's a flat prominence. You want to hit as high as humanly possible on that. So you find the top of it. You go 2 finger breadths below on that flat surface. I like to go 1 because you got to go as high as humanly possible on that to get better flow. The lower down you go, the thicker the bone, the higher, the spongier it is. Another site is also the humeral head. The best way to do that is, can I get a volunteer, please?
Sure.
Is, here, have a seat.
We're going to put an IO in your arm. Thank you.
Yes, put it on your arm. That's the next video. You take your hand and find the space between the pec and the deltoid. You take your other hand and put it directly midline. Take your thumbs, bring them together. You start to feel up for the little golf ball, which is the humeral head. Once you find that golf ball, and the biggest prominent point on there, that's your insertion site, right in there. You can also go in the, thanks, Clay.
You're welcome.
You can go in the distal tibia, right 1 finger breadth below the medial malleolus, which is the bony prominence on the inside of the ankle. The last site that we can use on adults is the humeral head also. So when you lay somebody flat, you take your hand and put them right around their abdomen, go to the inside, and then go straight down right in front of where their hand would be laying naturally. There's a bony prominence on the outside of the hip. You find the most prominent section of that, and that's where you shoot in. I think that's about it. That's about as much as 5 minutes can do for this. We talked about...
You're at 4.
What's that? I'm at 4? Questions, concerns, comments? What's that? So don't forget to set up your IO site. You want to sterilize with betadine or chlorhexidine. You're going to want to also prep your IV set properly. So we use the IO site. We use the IO, it's a proprietary IV set that we use. We prime that with saline. And then once we attach the set to the actual IO needle, once we've inserted it, you're going to want to blast that out with 5 to 10 milliliters of saline for adults, and then about 2 to 5 milliliters for kids. And you're going to want to put as much pressure behind that as humanly possible to blast out that marrow space. I know that the 2s and 3s in here probably haven't done very many of those things, if any at all. So it definitely helps to practice that if you get the opportunity. Thanks for listening. Questions, comments, concerns?
I think this class deserves an A.
Oh, well, thank you, sir. Thank you. Any more of those? Right. Tip your waitress.
All right.
And fill out your evals. Thank you.